Hi, this is Dr. Kurt Woeller for Integrative Medicine Academy. The title of this short video is Autism Spectrum Disorders and the Need for Mitochondrial Testing. So one of the things about individuals with autism or just autism spectrum disorders is there's many things that impact their overall health. And there's many things that can be done to improve their health, their level of function, etc. And dietary intervention has always been top of the list, as well as looking at gastrointestinal problems, candida, bacteria, other digestive system issues. We certainly know that mold, heavy metals, mycotoxins, for example, can play a role. And then all of these things are known actually to affect the methylation cycle one way or another that compromises aspects with regards to attention, focusing, cognitive abilities, as well as behaviors. But fundamentally, at the heart of all of this is mitochondria. And this is a group of individuals that often has dysfunctional mitochondrial function. And it's really important if you're working in the area of autism intervention is to understand this, because mitochondrial problems are not just one thing, it's many different things that can manifest differently. But at the core of what's happening with many of these individuals is the mitochondria are often compromised. Now, we know that mitochondria are these very complex organelles that sit within our cells. The average cell can have thousands of mitochondria that are producing the adenosine triphosphate. A unique thing about mitochondria is they have their own DNA. And so they actually can produce some of their own proteins that help in the maintenance or the function of the mitochondria. And so fundamentally, we know that the mitochondria are where the Krebs cycle lives, where the electron transport chain lives, and that ultimately we're trying to produce large amounts of ATP to run the engine, if you will, at the cellular level. And that would include everything from the immune system, the gastrointestinal system, the musculoskeletal, cardiovascular system, as well as the brain and nervous system. And so when we get down to the level of the electron transport chain, for example, there's all kinds of things that help in the transportation of electrons from one complex to the next, and that's where our name electron transport chain comes from, ultimately for the production of ATP. Well, if we look at autism just sort of from a conventional standpoint, we know that there are brain regions which are often compromised. So the temporal lobe, which is involved in speech and memory centers. The frontal lobes can be compromised. The cerebellum, which is involved in motor skills that can affect proprioceptive abilities, for example, can be compromised. And then even issues relating to emotions are often compromised. And so the brain is the most metabolically active organ in our body. It needs a constant supply of ATP to function. And so if we have mitochondrial problems, we're going to end up having, in many cases, neurological issues that can manifest. But it's not just the brain that's involved in autism. Often these individuals have gut problems too. In fact, it's a major comorbid factor in autism is to have some underlying GI issue. And so when the gut is imbalanced, the brain is going to be imbalanced. And there's a lot of evidence now to show that mitochondrial problems can even affect the digestive system. And that imbalances in the gut often contribute to many of the behavioral problems, the cognitive problems that are seen in autism. So at the heart of this integrative functional medicine approach, or what's sometimes called the biomedical approach to autism, is really understanding the connection between the gut and the brain and really working on the gut through diet, through assessment, looking at fungal, bacterial, parasitic toxins, other types of toxins that affect gut function, and how that can translate into problems at the neurological level. So laboratory testing is a major component of any kind of approach for an autism individual. And I'm just going to focus on two specific tests. This was a paper that came out in 2007. Now, this particular paper was looking at mitochondrial dysfunction and molecular pathways of disease. It wasn't specifically looking at autism. It was discussing a wide variety of disorders, from schizophrenia to bipolar to dementia to Alzheimer's, epilepsy, etc. Can all have underlying mitochondrial problems. But the key point was the sentence I have underlined: physicians seeking systemic treatments for their patients might consider testing urinary organic acids to determine how best to treat their patients. So Mosaic Diagnostics, which is taken over, which was formerly Great Plains Laboratory, has a very comprehensive organic acids test. And the organic acid test is a fundamental test to have done for any individual on the autism spectrum, because what we're looking for is not only the yeast and fungal and bacterial markers that can compromise health, but we're also getting assessment of mitochondrial activity, and specifically looking at glycolytic metabolites, which is linked to glycolysis. That's not specifically happening in the mitochondria, but it's happening in the cell that then translates over into mitochondria, looking at Krebs cycle markers, and then even certain amino acid metabolites. If you look at this particular individual, this is actually a child with autism. They have very high levels of lactic acid. And there's many mitochondrial disorders that can actually lead to lactic acid. That can generate a lot of stress in the body. And we've got a number of other markers that are elevated, from fumaric to malic to aconitic to citric. Citric, for example, is often elevated when some of the first steps in Krebs cycle activity are being interfered with. You'll also notice that this individual has a CoQ10 deficiency. This specific marker 3-hydroxy-3-methylglutaric, when it's elevated, indicates a CoQ10 deficiency. And CoQ10 is a major electron transporter or transferer, if you will, within the electron transport chain of the mitochondria. Now, looking with regards to primary mitochondrial disorders, for many years the gold standard has been doing muscle biopsy testing. And what's very difficult about these mitochondrial disorders is that they're really tied to what's happening at the electron transport chain level. And so proteins that are influencing the electron transport chain are both produced in the mitochondria and the nucleus of the cell. So they're coming from two different compartments. And not everybody's going to have the same exact makeup. So there was a paper that came out in 2011 looking at non-invasive strategies, particularly through buccal swab assessment of respiratory chain enzyme activity. Okay, the respiratory chain is the electron transport chain. And so they're trying to determine, could you do buccal assessment that could have a high correlation to muscle biopsy? And what they found was that approximately 84% correlation with a buccal swab looking at certain components of the mitochondria compared to muscle biopsy. So the mitoswab test is not diagnosing specifically a mitochondrial disease, but it is indicating problems that are occurring within key areas of the mitochondria that have a high correlation to what is seen on a muscle biopsy test, which is the gold standard or has been. And so it is indicating an underlying or problem that is existing within the mitochondria that can then be strategized and sometimes even compared with information that's coming from the organic acid test. So you'll notice in this particular individual that complex 1, which was the first step in the electron transport chain activity, is low. Its activity is low. The test isn't telling us necessarily why it's low, but it's important to understand when you start getting into more deeper aspects of mitochondrial activity that complex 1 can often be compromised because of chemical exposures, for example. We could have a CoQ10 deficiency that could compromise its function. But what gets to the pathogenicity aspects of mitochondrial issues is that complex 1 is also the major leaker of electrons. And so if it's leaking electrons into the matrix of the mitochondria, well, that is increasing the potential for oxidative stress reactions. So that 84% correlation is important. So we can use the mitoswab to assess activity of complex 1 and complex 4. Remember, there's 4 primary complexes, complex 1, 2, 3, and 4. And then there's the ATP synthase, which is what's making the ATP. Sometimes that gets referred to as complex 5. This test also looks at citrate synthase, which is the first enzyme in the Krebs cycle that combines acetyl coenzyme A, which comes from pyruvate. So from up here, we have glucose or glycolysis, which produces pyruvate. Pyruvate gets converted to acetyl coenzyme A through an enzyme called pyruvate dehydrogenase. That then combines with the last step of Krebs cycle activity, which is the oxaloacetic acid. And so citrate synthase, you could almost claim this would be like a rate limiting step in essence for Krebs cycle activity. That's what produces citric acid. And then citric acid moves through the next steps, all through their own enzyme reactions. And so the mitoswab looks at citrate synthase. It also looks at complex 1 and 4 of the electron transport chain. And then the organic acid test gives us a little bit more of a deeper dive into the Krebs cycle aspects of it. And being able to combine the information is fundamental. And this is something that I have done in practice for many years and also teach about in a very in-depth way through our different mastery courses. Now, when it comes to autism, we have the Autism Mastery Course, which is a very comprehensive course on biomedical intervention. That would be integrative and functional medicine aspects for autism intervention. It's extremely detailed, and we are currently in a major crisis mode in not only here in the US, but around the world. In the US, we're looking at about 1 in 36 kids now being diagnosed autistic. And by the way, that's classic autism. That's not counting many of these other kids that might have other sort of spectrum issues, for example, that don't necessarily meet all of the diagnostic criteria of autism. The numbers continue to get worse. Okay, and so us as practitioners really need to be familiar of how to help these kids and help the families who are trying to help their children. So the Autism Mastery Course is all about that. Okay, this is a course about the fundamental aspects of biomedical intervention for autism. We have another Autism Mastery course starting on Wednesday, May 31st, 2023. Now, we have courses that are available for purchase at any time. This is the next live version of this course. We also have a very in-depth mitochondrial course through Integrative Medicine Academy. And this is a very detailed course on the topic of mitochondria. With the Autism Mastery course, we do talk about mitochondrial dysfunction. It's not the only topic we get into. We're getting into many different topics in this course, from gut issues to nutritional deficiencies, to metal problems, to mycotoxins, to laboratory testing, to different types of clinical scenarios. But the mitochondria is a very important component. And so in this particular version of the Autism Mastery course, I will be pulling some information from the mitochondrial course to show the relationship to this autism discussion. The Autism Mastery course is not a duplicate for the Mitochondrial Mastery course, for example. So if you're wanting much more in-depth information on mitochondria, that Mitochondrial Mastery course would be recommended. However, the Autism Mastery course is robust, it is comprehensive, and extremely valuable for any practitioner who is currently working with this population or looking to work with this population, to really be able to jump in very quickly and start making a major difference for these individuals and their families. For more information about our courses through Integrative Medicine Academy, you can go to integrativemedicineacademy.com. That would also include the Autism Mastery course, which can be found also at autismmasterycourse.com. And if you have any questions, you can always email us at integrativemedicineacademy@gmail.com. Once again, I am Dr. Kurt Woeller for Integrative Medicine Academy. Thank you.